Four top officials of the Oklahoma State Department of Health have left the agency. Health Commissioner Terry Klein, his top deputy Julie Cox-Kane, and Business Planning Director Felicia Scanlon all resigned. As Interim Director Preston Dorflinger took over, he forced out the agency's chief lawyer, Don Mach. Now, state investigators have to figure out what happened to at least $30 million.
Last month, state auditors began poring over the financial records at the State Health Department. Their work is focusing on claims of misappropriation of funds and overspending, allegations that led to the four officials leaving the agency. Last month, Dr. Terry Klein made a presentation to the Board of Directors for the Oklahoma City and Tulsa Health Departments, as well as the Board of the State Health Department. During that presentation, he detailed a series of programs that have been cut or eliminated because of the agency's financial condition, something he blamed on 9 years of cutbacks by state government.
Over my career, representing about 15 years, I will tell you this is the most challenging environment that I have encountered in my entire public health career.
Klein told the boards that the agency has lost more than $20 million to state budget cuts.
There are a lot of changes that have occurred in response to our budget reductions, and we have a bit of a perfect storm. At the same time that we have had our state reductions, we're also seeing reductions in many of our federal grants.
And the agency is now in the midst of twice-a-month employee furloughs impacting nearly 1,500 people. Reductions in staff are also underway.
Since 2009, the Oklahoma State Department of Health has about 260 fewer staff.
Oklahoma's current health ranking is 46th in the nation. 9 years ago, the state ranked 49th, and Oklahomans are still dying at a higher rate than the rest of the nation. During his presentation, Dr. Klein pointed to the legislature as the place where changes were needed for the health of Oklahomans to improve.
Unless we are aggressive with that agenda, and unless we see policy change at the state level, we'll see small improvements, but not of the scale that we need to see and not of the scale that Oklahomans deserve.
Once again, State Finance Director Preston Dorflinger's been tabbed to take over a state agency in trouble. Dorflinger telling agency employees recently that without an infusion of funds from the legislature, the agency eventually would be unable to make payroll. "I can't tell you how narrow of a situation this was," he said, but it was within a very narrow sliver of becoming more than a crisis. Dorflinger says he has talked with lawmakers and he's confident more cash will be provided to make payroll. Agency employees have warned for years of financial wrongdoing at the State Health Department in letters to former Attorney General Scott Pruitt and the FBI, but it appears no investigations were ever launched. State Auditor Jones expects his work to be done by February of next year.